This is Chris Kelly with a couple lower body interval progressions that you can utilize to help to teach your client basic movement. Now, one thing we often see with new clients coming in with lower back or knee injuries is both a risk of injury or somebody that's tested poorly in their FMS scores, just a lack of coordination movement. So when we ask them to do maybe a skip, a side shuffle, or produce something in an interval circuit, they're going to compensate in one way or the other and present risk of injury. In order to teach basic movement, we're going to start them in a transitional posture that Greg Cook talks a lot about in his book Movements. All right. For bilateral exercise, if they're showing deficiency in squatting patterns, or they test low in maybe their overhead squatting pattern or active straight leg raise pattern, we're going to start them out tall kneeling. If they're testing poorly in their inline lunge pattern or maybe single leg stance, we're going to start them out half kneeling. Maybe they're a runner, maybe they're doing single leg activities in which they're compensating in some way or the other. We want them in this posture. But in either case, we can utilize things like dumbbells, medicine balls, and even bands to really crank up the intensity. At the same time, we can integrate this pattern in standing positions with assisted exercise, as I will demonstrate. Now, with a medicine ball, we're going to start them out in a half kneeling posture. We can do things like tall medicine ball tosses against the walls, medicine ball slams, and even medicine ball throws where they're coming to the part where they're throwing to a partner. We can also do chops across the body, curls to press. Really, the sky is the limit. The same thing applies to dumbbells. I've got a pair of 3 to 5 pound dumbbells here, and what with these, really the goal is to reduce vigorous movement perturbation in this position while maintaining this tall posture. All right, what I'm looking for the client to do while they're performing, these various exercises, presses across the head, over the head here, chops across the body, maybe punches to each side, is just maintain this stable base, stay as tall as possible, and when I see them compensating, I'm just going to shut down and move to the next drill. Now from here, at the same time, we can have them perform, 1 to several exercises in that transitional posture. We can move them onto the wall here, over to the wall here, and I'm using a Greg Cook band here, okay, to just produce an assisted squat. All right, I'm going to ask the client to just sit back on their heels. You only use the band as much as necessary to provide support. And as I go along, I can help teach. I'm going to teach them this hip hinge and incorporate different squat variations, like maybe a squat to calf raise, a squat to a side kick, different things to get the client's heart rate up, while at the same time teaching these movement patterns. As the client progresses, we can move into a static half squat position or a static split squat position, and then finish up in phase 3 with actual movement, integrating the squat with upper body movement. Once the client gets to this level, they've demonstrated proficiency in either bilateral or single leg stance, and they're ready to move on to more vigorous interval training.